This is where I love the science, right? It seems like a lot because it is a few needles, but it's not really compared to what a baby's encountering every single day. There's a lot of fake news about these ingredients that is out there. It's just not backed by the science. It's very simple. Vaccines don't cause autism.
I didn't know that it was retracted or he got disbarred.
In the past 50 years, 154 million lives have been saved by vaccines.
Vaccines protect children from serious diseases, but that doesn't stop parents from having questions, particularly when immunisation has become such a hot button issue in some corners of the internet. So, why do kids need so many vaccines? How do you manage the side effects? Why does my child need to be vaccinated from a disease I've barely heard of? Professor Kristine Macartney, Director of the National Centre for Immunisation Research and Surveillance, is joining me to help answer these questions and more, as well as reveal the unscientific origins of one of the most popular and baseless vaccine conspiracies. Welcome, Kristine. Thank you for coming.
Oh, thank you so much, Sophie, and it's a pleasure to be here.
Give us a little bit of information about yourself. Who are you? What do you do in your day?
So I'm a paediatrician and an infectious disease specialist, and I started my career mainly in the hospital looking after children, with serious infectious diseases. And as my career proceeded, actually from the time I was quite a young doctor, I started to feel very passionate about preventing those children from being hospitalised. And as more vaccines became available and I could see when they were being used, disease was being prevented. So then after my initial infectious disease training, I went on to train more in vaccines and did a PhD in vaccines, trained overseas. And now most of my time is spent looking at how we can introduce or improve coverage from vaccines to really equitably protect not just children now, but adults as well.
So you mentioned what made you want to go into this form of medicine, but what made you want to be a paediatrician in the first place?
I wanted to be a doctor from quite a young age. My mum was a nurse and she inspired me. And, so I just have always really loved that you can both care for people, but there's this really cool science underneath it, and it's fascinating. And then I love children. I mean, I don't know, it's that simple. They're just so fun. They grow so fast, they change so quickly. Oh, I'm going to get teary now. But and it's not just about the child, it's about the family, I mean, we have such a huge responsibility for every child that comes into the world. We want to give every child a great start. And, bad things do happen. They happen. And where we can, we want to prevent those things from happening in the first place. So prevention has just become my biggest focus. And yeah, it's been great.
And so let's start with one of the biggest questions. Why do you think the topic of vaccines give parents so much fear?
Oh, look, I think being a young parent is a tricky time, right? There's a lot of emotions involved. You're sometimes on a roller coaster. You feel an overwhelming sense of responsibility sometimes. And it's pretty exhausting as well. So all of that put together, and then someone comes along and says, I want to give your baby these little jabs, and keep them healthy. It's a bit confronting sometimes. And I think it's completely okay. In fact, it should be the case that parents have questions, but most importantly, that they're getting those questions answered. Sophie, there's a lot of false news, fake news out there. There's a lot of misinformation. Maybe it feels really, or it sounds really strong and really well backed, but in fact, it may not be. And so I think, it's an emotional topic, but it's actually one where we have a lot of great health professionals, a lot of great information that parents can seek out at an important time for their babies' lives and for them. A great statistic to remember if you're a bit nervous when you're in the waiting room for your bub to be vaccinated is that in the past 50 years, 154 million lives have been saved by vaccines. And, that's a huge thing. So by vaccinating, you're protecting your child, and you've got decades of great science and dedicated health professionals to back all of that up, and so you can feel confident.
Yeah, absolutely. Why so many vaccines, and why do we start so early as 6 weeks?
So firstly, the youngest babies are the most vulnerable to some of the serious diseases that vaccines protect against. So, diseases like whooping cough, for example, rotavirus, meningitis caused from a range of different bacteria, some of which the vaccines protect against. All of these hit tiny babies the hardest. And we know vaccines safely train their immune system from a young age. So we start the schedule early to just go through that training with a baby's immune system and offer them the protection when they need it. This is where I love the science, right? So babies actually have an amazing immune system that is super adaptive. So you think about it, they're in the womb, they're in this sterile, protected environment. And then when they're born, it's like they're just on this huge learning curve. Their little brains are growing, they're changing every day, developing, and their immune system is also doing that. So it's the moment they're born, it's, encounters all these kind of things in the environment, antigens, bacteria, microbes, and their immune system is adapting to that. And what we're doing with vaccines, it's very focused on just a couple of serious, really serious diseases. So when we give vaccines, there's very few actual things there that stimulate the baby's immune system. It seems like a lot because it is a few needles, but it's not really compared to what a baby's encountering every single day. And their immune system's doing just great on that. We're targeting those nasty, nasty microbes that if a baby met those, their immune system would be overwhelmed and they would likely have a serious infection. And we're training the immune system, because it's in training anyway, we're training the immune system with our vaccines. Completely tested to give that many vaccines at once, shown to be safe, shown to be effective as recommended in the schedule. So don't worry about too many vaccines at once. Don't worry about the too many vaccines overwhelming the immune system. It's really finely tuned to protect bub, and that's what we're all about. I want to put a plug in for pregnancy vaccine too, Sophie, because that's a fantastic way where mum will take the vaccine during pregnancy, pass high levels of antibody over to the baby when they're born. They can be protected right away. And there's a couple of vaccines we also give from birth. The schedule then starts at around 6 weeks of age in Australia.
What is the research that we have in Australia that I guess supports our schedules? A lot of my friends are from other countries and they're confused about what system to follow and why it's so different.
Great question. And the main thing to know, I think, is that each country tailors its own immunisation or vaccine recommendations according to the local disease patterns. So the epidemiology of the disease. We have very high rates, for example, in Australia of whooping cough. They've come down a lot because of vaccination, but it's still around. So, that's one of the reasons, for example, that we'd vaccinate early here. We don't vaccinate quite as early for measles in Australia because we don't have continuously circulating measles. But at the moment, there's a lot of measles in the world.
I've seen a lot of news recently about measles coming out.
A lot of measles.
Fascinating.
And, it's also a very, very serious illness. It can cause brain swelling and permanent brain damage. So for measles, we routinely give the vaccines in Australia at 12 months. But if you're travelling overseas, you can give your bub an extra dose of measles vaccine as early as 6 months. So they're not unwell when you're on that special trip, to visit family, friends or a holiday. So there are nuances in the schedule, which is, again, why it's a great reminder to check in, with your GP or nurse who are very knowledgeable about any of those questions.
Some parents say they've heard it's okay to space them out or delay them a bit. What's your advice on that?
Look, delaying vaccines increases the risk that your child or you will have a serious disease. It's that simple. So we time the schedule so that it gets protection on board when diseases strike most commonly and most seriously. So delaying vaccines, it doesn't reduce any side effects. In fact, it can actually cause more disruption to your life and to the bub because you're doing multiple visits, maybe spread out over a longer time. And we know it's safe to give the schedule in the way it's recommended. That's been studied very carefully. So we don't recommend delaying vaccines.
So let's talk about side effects. Parents often talk about how, my child didn't react much for the last vaccine and then suddenly this vaccine, they're having meltdowns. Why does it change for each time they have a new shot?
So it's good to know what to expect when your baby's vaccinated, and your nurse or doctor should take you through that. There's quite a lot of information about what to expect. Vaccines are very safe, but they do cause minor short-term side effects, which are typically just feeling a little sore at the site of the injection, maybe feeling a little grizzly or fussy, and possibly, not all babies, but some babies will have a low-grade temperature. That only lasts for 1 to 2 days. And cuddling, soothing, just a bit of extra TLC in that day or two is absolutely usually all a baby needs. If a baby has something more serious going on or you're concerned, it's possible it's the vaccines, but more often we find that it might be something else that just coincidentally has come up at that time. It might be something that is short-term and you don't find the answers to. But either way, it's important to check in because the side effects from vaccines are short-lived, they're mild usually. And if people are finding or parents who are concerned about something, check in, call your GP, dial Health Direct.
Absolutely.
But again, generally speaking, most babies tolerate vaccines just fine. And we know they're safe in the long term too. So we know that the vaccines have been tested and trialled and monitored and followed up over decades and decades, and we know that they're, really safe. So it's important that parents feel confident about that. Don't worry too much.
Yes, agreed. I know one thing that I went through when my son was getting vaccinated when he was younger, and it's spacing out some of the vaccines by a week just so that they didn't give, the reaction wasn't as bad. What's your recommendations on that? Is it best to get it over and done with in one go, or does it make a difference separating it?
Look, I think mostly we try to stick the vaccines that are recommended at one schedule point together. There are a couple of places in the immunisation schedule where there may be an additional vaccine to consider, and in that case, it might be sensible or reasonable to, with that additional vaccine, perhaps one that isn't on the routine schedule but is an optional one, that you may space that a little bit more. And that's partly because it also may be at a cost to you or for other reasons. But in general, we recommend sticking to the schedule as it's provided because we know that those combinations of giving vaccines are safe.
And what about the painkiller aspect? Do you recommend giving it before an injection? I know some doctors ask when I brought Frankie and it's like, well, has he had like paracetamol or ibuprofen yet? Does it help? Is it worth it?
No, it's a great question. We don't routinely recommend for the vaccines on the schedule that you give paracetamol beforehand. If your bub's unsettled or has a temperature afterwards, certainly paracetamol, according to the instructions, is fine to give. One of the vaccines that is optional, not on the routine schedule in some states like New South Wales, but available in some other states, is a vaccine against meningococcal B. And that does tend to cause a higher chance of fever and slightly higher fevers after vaccination in the first day or two. Again, that settles, it goes away, but if it's making bub grizzly or uncomfortable, then paracetamol can be given. And some practices and doctors and nurses will routinely say, just give a dose, this evening when you get home if you've had that meningococcal B vaccine.
I know that's the one Frankie reacted to, probably the worst out of all of them. And it was the same situation. Like that day he was a bit grisly, but by the time he went to bed, he was fine.
Yeah.
He was all good. And there's so much online about parents worried about ingredients, whether it's mercury, aluminium, preservatives. What's the truth?
Look, the truth is all of the ingredients or trace elements in vaccines that we use are thoroughly tested. They're shown not to cause harm. They're not associated with serious side effects. And I can't stress that enough. There's a lot of fake news about these ingredients that is out there, and it causes completely unnecessary alarm and concern. And it's just not backed by the science. So stepping through it, there are trace amounts of aluminium in some vaccines, and that helps just to boost the immune response at the injection site. That actually aluminium probably does cause a little bit of the irritation that we sometimes see at an injection site, but that's part of just helping boost the immune system to protect against the disease. It doesn't cause long-term side effects, and the trace amounts of aluminium that are in vaccines are actually much less than what a baby's going to ingest from milk, including breast milk, food, and lots of other things in the environment. It doesn't cause harm. Likewise, for this substance called ethyl mercury, it used to be in vaccines in Australia that were in multi-use vials where we'd sterilely take out each injection. That's been removed because we only use single-dose vaccines in Australia, but it's not harmful. It's used in lots of other parts of the world, and there's been many studies over many decades to show that these ingredients are safe, they do not cause harm. Come back to your trusted sources, GP, nurse, pharmacists that can take you through some of those concerns. There's some great resources online as well. Health Direct's good, the different health departments. There's a fantastic resource called SKI, SKAI, which is sharing knowledge about immunisation, and it's got a dedicated website for parents and also actually for doctors and nurses to help train them to talk about things in a clear way with families.
That's incredible. I've never heard of it.
Yeah, so skai.org.au.
I guess topically right now in the news, it's vaccines and the effects it has on autism and whatnot. Can you share a bit of truth around that?
Yeah. Look, I think the most important thing to know, it's very simple. Vaccines don't cause autism. Now, as a paediatrician, an infectious disease specialist, why am I so confident in saying that? I'm confident because we have 30 years, actually much more, but, let's focus on the last 30 years, of amazing science that says that vaccines are not associated with autism. They're not associated with a whole range of other serious diseases. It all started, Sophie, back in the late 90s. There was a fraudulent study published which kind of said this and this, and then maybe vaccines cause autism. Now, that study had to be retracted. The doctor who led that study was disbarred from practicing. That doesn't happen very easily, but it does. It did here. But this kind of concept was just taken up, and there's a handful of people, just a handful, who spread this message. And they've shifted their theories over time to say it's not the MMR vaccine, now it's mercury, now it's aluminium, now it's paracetamol. The sands keep shifting. We want to put the research funds into actually finding the true cause of autism, but it's not vaccines. And so I just really want to reassure everyone that there's been dozens and dozens and dozens of studies in more than 10 countries over 30 years. Vaccines don't cause autism.
Wow. Yeah, it's fascinating how that one point of mistruth can spread like wildfire. And, the fact that he got disbarred and got retracted, I didn't know that it was retracted or he got disbarred. And it's like that stuff just gets pushed to the side.
And I mean, there are voices that say, "Oh, but you haven't seen this study." But if a qualified person reads that study, they can see that that study is very poor. It's very non-scientific. It doesn't actually give you a valid truth. And then over here we have these amazing high-quality studies, things that the science that we rely on every day in our lives, to run our phones, fly planes, help treat people with cancer, all of this good science. That good science tells us in the same way that vaccines don't cause autism. And parents can be really confident about that.
Someone who isn't from the medical world, they might read a report and be like, yeah, that is so
And it
true.
looks credible. You see it in a second. Even if you're not sure, it goes in.
Yeah.
Right? I mean, that's
And it
this whole
sticks
thing.
with you.
And then it sows a little doubt, and we know if there's doubt, there might be delay. And that's what really concerns me, is that people are getting torn up about whether this is the right thing to do, when with what we're doing with vaccines. The world eradicated smallpox, and it's the only human contagious disease that we have eradicated. That virus is gone. And what that has meant is hundreds and hundreds of millions of lives being saved. And so we can't eradicate every disease through vaccination. It's important to be realistic and honest about that. We seek to really control many diseases because it's not possible for a whole range of scientific reasons to eradicate every disease. But keeping diseases that are serious and deadly at very low levels is incredibly helpful and incredibly important. The key thing for other people to know, this is a common thing. People say, I didn't think that disease was around anymore, and I wasn't sure I needed to vaccinate because of that reason. So the diseases are around. They just may not be in front of our eyes every day, which is a good thing, which means our vaccines are working. But I always say they're only a plane ride away, and you don't have to get on the plane, and your child doesn't have to get on the plane. You just have to pop to the supermarket, and you might bump into someone carrying measles on their trip back from wherever.
Yeah.
So, the diseases are still around. We still need all of these vaccines, and they have kept us safe and well. That's why we don't see the diseases.
Yeah, absolutely. I remember that's why it shocked me when I opened my phone and I saw there was a measles case somewhere. And I was like, oh, I forgot that's still around, because you just I've never met anyone with it. It's like you don't hear about it as often, even whooping cough.
I think, to be very personal, I cared for babies that we couldn't save from whooping cough, children that died from measles. And children whose airways blocked over from bacteria or had, permanent brain damage from meningitis. I do not want to see those diseases affect any family. And that's the key for us. We can use vaccines to keep healthy, to keep well. We do actually have quite high vaccination rates in Australia. Most parents fully back immunisation. They get their child, vaccinated on time. And generally speaking, we were right at that sort of 95+% coverage point. In the last few years, that's been lower. There's been a little creeping down in coverage rates. We're still doing okay, but we'd like to do better because it means more, people protected. When a lot of people are vaccinated, we know that those viruses don't spread as much. We know that we can protect people even if they're not able to have a vaccine themselves. Some people who are very either unwell at the time or have long-term conditions where their immune system is suppressed, like people going through cancer treatment, they may not respond to vaccines. They can't necessarily have vaccines to protect themselves. So by us being vaccinated and all of us being vaccinated, we can decrease the spread of these nasty diseases in the community, and we can protect the most vulnerable. So
Absolutely.
It's not just an individual story. It's about being a great member of a community and protecting others that we care for the most.
What are 3 messages for parents that you'd love to pass on?
Gosh, well, number one, vaccines do really save lives. They're thoroughly tested to be effective, to be safe in the way that they're recommended in the schedule. And by vaccinating, you're doing the best for your child. I think seek out a trusted healthcare professional who, for many of us, have spent decades training, learning, continuing to be, up to date with the latest information, and establish a relationship with them. Be confident, check good resources that are available around immunisation from trusted sources, and know that, you can give your baby a great start in life through vaccination.
Before we wrap up this episode, we want to ask one more, a bit more personal question. Is there a story or a moment that has shaped your career and made you practice medicine the way you do?
Oh gosh, Sophie, there's probably many. One springs to mind. I was training as a young children's doctor. A young girl was admitted with measles. She was very sick. She got better. We managed to, get her actually to be really well. So as she was getting better, she was still contagious from measles. She wandered out of her little hospital room and she wandered in and visited all the other babies and all the other children in the ward. Just took a second. Didn't take very long. And she gave a number of them inadvertently measles. And one of those children already had some health issues, was seriously ill and died. So, these are highly contagious diseases. They're very serious diseases. And all I could think about was, gee, if we'd managed to just give her a safe, timely measles vaccine when she was young, she wouldn't have had to come to hospital herself with measles. It wouldn't have spread to those other bubs. Remember that through immunising a large proportion of the population, we're protecting some who are the most vulnerable. Maybe their immune systems have suppressed because they've got cancer and they're on chemotherapy or they've had a transplant. They're the people we really want to protect. So all I could think about after that was this all could have been prevented.
And the child didn't know any better.
Well, she was just a little one. She was just going off to visit the babies while she still happened to be, and took it. It happened in a flash. We want children to get the best start in life. We also want to respect their parents, and putting that all together is part of the I think the amazing privilege of being a paediatrician. It's part of the amazing privilege of working as a healthcare professional. But it is a privilege, and I don't think any of us should ever take that lightly. But I hope that makes us all better in trying to communicate, the really best knowledge and evidence and ways, doing things the way that families, hopefully can respond to, and together we can, keep ourselves healthy and well.
Absolutely. Well, thank you so much for coming on the show today.
No.
It's been lovely to speak to you.
And you also, Sophie. It's just been an absolute privilege, and thank you for having me, and thank you for doing this podcast. And
Thank you. And thank you for your work. You're an incredible doctor, and we're very appreciative for your knowledge.
thanks so much.
Thank you.
Thanks for listening to Kids Health Explained, a podcast created by the Sydney Children's Hospitals Network and hosted by me, Sophie Delezio. This season, we're covering some key kids' health issues, including when to go to the ED versus GP and starting your baby on solids. So check out our feed on whatever platform you're getting us on. To stay up to date on episode releases, please subscribe and follow Kids Health Explained. Finally, please leave a review, and why not tell a friend or a relative about the show too? See you soon.